Hey guys, Dr. Pat here from Superwell in Albert Park. Are you suffering from persistent knee pain, you have old injuries in the knee that aren't resolving, or you just feel like you want to have good knee mobility through your later stages of life? We're going to give you 6 tips today that are going to help you have healthy, long-lasting knees. So for our first exercise, it's more of a stretch. We're going to be focusing on the quadricep muscle group. It has a big impact on how well your knee is functioning and whether we're going to be able to resolve what's going on. So there's a couple of ways that I like to teach people how to stretch their quads. One is the most simple way. It's the one that you would have seen if you played any sport growing up. We're just going to have our body nice and stable, and we're going to be just stretching through the quad. So we want to be activating and squeezing the quad almost by kicking our foot down into our hand. So coming from side on, we're just pulling through on our foot, but also kicking down with the foot at the same time. So that's a nice stationary stretch. The advanced one of this, you can do this with a chair, or if you've got a table at home, just to make sure that you're nice and stable. We're going to be coming onto the surface, dropping our hip. Which way do we? So we're going to be coming on, popping our foot onto the surface, dropping the hip is what the side you're trying to stretch, and same thing, kicking that foot down into the chair. So you're driving from the top of the foot. You'll feel a burning sensation through the middle of the quad that might go down towards the knee. That to me is a more strong stretch, but it's a way more effective way than our stationary quad stretch. So for exercise 2, again, nice and stationary, no equipment needed, just a really simple way to open up some of those restricted areas to the knee. So we're going to come to a wall, going to get nice and sturdy with our back against the wall, dropping down to 90 degrees, so bring your feet out so you're at 90. We're just going to hold a wall sit. This is going to also strengthen your glutes, take a bit of pressure off your hamstrings, but it's going to stretch and strengthen some of those really important areas that are involved in knee pain. So for our third exercise, we're going to be targeting a muscle that has one role in our legs movement. So this muscle is called your popliteus. It sits at the back of your knee and it extends the lower half of your leg. A lot of people have dysfunction in this area, and if you've got a history of Baker's cysts or injuries at the back of the knee, this area generally has dysfunctional movement. So it's a really easy muscle to get into. It's not fun, but it's easy. We're going to just sit down. We're going to stretch our leg out. You'll feel that then that muscle is nice and active. So if we come up from side on here, you'll feel as that drops away that that's nice and active and switched on. We're just going to do some soft tissue release. You can use your physio cream again to open up and get rid of any inflammation. You'll find those sticky spots, hold those and just feel that muscle release. Same rule of thumb as when we're doing our stretching or our exercises. If any pain level is above a 4 out of 10, ease the pressure or just wait till tomorrow and try again. For our next exercise, we're going to be doing something that's really simple. Again, requires no equipment. You can advance this to be holding weights or having weights involved, but at the start, especially if we've got a fresh injury, we're just going to be using our body weight, and that is sort of an advancement from our wall sit. We're going to be doing some squats. So nice posture, keeping your back nice and straight, and just dropping through and just doing a few reps. 10 to 15 reps every few hours, just getting healthy function, healthy movement through that knee joint. And again, strengthening a lot of the supportive structures that when they're dysfunctional, cause more impact on our knee in the ways that we don't want. For our next tip, this is less of an exercise, but more of a daily practice we want you to have as part of your routine every day. We put our shoes on and take them off multiple times a day, so we might as well use that to our advantage. From today onwards, no more sitting down to tie your shoelaces up or to take them off. We're going to squat. We're going to take our knee through full range of motion, something we rarely do in our modern lifestyles, particularly if we're sitting, we're only getting it to 90 degrees. So untying your shoes, coming back up. Every single time we do that, we're also doing a full deep squat. So again, we're impacting more muscle groups than just the knee. We're opening up that whole involved circuit that can either make our knees far healthier or far worse. For this exercise, we want you to find a low anchorage point because we're working on doing a hamstring curl. As much as the quads are involved in knee pain, so is the hamstring. So we're going to have our low pivot point, and we're going to be just standing on one leg, doing a hamstring curl. Trying to keep it on the lower half of the leg and activating through that muscle group there. So you'll feel this right in the mid belly of the hamstring. Really easy exercise to do. You can obviously do this at the gym with a hamstring curl machine, but this is the easiest, most accessible way. If you need a band, you know where to come. We'll sort you out. This has been Dr. Pat for Superwell in Albert Park. If you have any questions or queries, or if you've got knee pain that isn't resolving, feel free to use these tips. But also, if you need a second set of eyes, feel free to come and check out one of our chiropractors. We're more than happy to help, and we have a wealth of knowledge when it comes to knee pain.